this is a very important session that we're dealing with tonight, and the information was just updated as of 2 minutes ago. And so I'm really grateful for lots of things, and I'm grateful that we have this opportunity of telling you some really important information. And I don't think people understand what has been accomplished in less than a year. To me, this is the equivalent of landing a man or woman on the moon in 1 year. To develop a successful mRNA vaccine, which has never been done before, to develop a new vaccination against strains that we call the common flu influenza, that has the potential to decrease spread by about 90% and severity of disease by 90%. It's truly extraordinary. And so what we're going to do is we're going to take you through a story about what we said today, the questions that we do know, and we still have a lot to learn right now. So I would never thought at this point in time we would be at this stage when it comes to vaccinations. And so Jenny and her team has put together a very nice presentation. I just modified it many times, and I might modify it again as we go on, but that's okay, because the information is changing and it will need to be modified again tomorrow, the next day. And here's where science has come to the front. Mm-hmm. All right, Jenny, take it away.
All right, so I'm just going to start by introducing everyone. Well, first of all, thank you all for joining us this evening to discuss everything from the COVID-19 virus to the vaccinations that have come out recently. So my name is Jenny, and I'm actually joined today with Nurme, Frank, Fakita, and Aisha, and I want to thank them for helping me put this together. They've been so great. So yeah, like I said earlier, you can move on to the next slide. We'll be discussing everything from the COVID-19 virus to social distancing and wearing masks, the vaccinations in general, and then common concerns that people have. And everything that we're presenting today is backed up with evidence-based literature, which is updated as of, like Dr. Curnew said, just 2 minutes ago. So just keep that in mind, because there could be a lot of changes, and there will be a lot of changes that are made in the near future. So nonetheless, I hope this presentation provides information that just helps keep you informed and just possibly even encourage you to get the vaccination. Next slide. Nurme, I think you might be muted.
Okay, can you hear me now?
Yes.
Okay, perfect. Yeah, it's a little finicky sometimes, as is all tech. So yeah, we're just going to start off by asking the very simple question, what is a coronavirus? And if, if you really look at it, the way they named this subset of viruses is because under a microscope, it looked like this virus had a crown on itself, and hence coronavirus was the name that they gave. And so it's important to know that the current pandemic has been kind of caused by a specific coronavirus called the SARS-CoV-2, SARS-CoV-2, and the disease itself is known as COVID-19. So there's a little bit of a difference there between COVID-19 and SARS-CoV-2. So the virus name is SARS-CoV-2, and the disease that it brings upon is COVID-19. And essentially, this is what's known as a zoonotic virus. And so that means it basically spread from animals to humans. And one thing I kind of want to emphasize right from the get-go is that all of the work that came out with this vaccine hasn't just come out because, out of the blue. It's actually come out through a lot of research and a lot of previous work. And it's, we've seen things like in the past SARS-1, and we've seen things like MERS, and so those were past coronavirus outbreaks in the last, I think, in just the 21st century that we've seen. And so all this work has kind of amalgamated into creating these vaccines. And so I think one of the most important things to learn about is how does SARS-CoV-2 take us to the symptoms? And so we want to know basically what happens.
Very important. This work is being, coronavirus has been around for a long time. It causes the flu, it causes influenza, it caused SARS, caused Ebola. So these are all the same category. And so the knowledge space has been around for a long time. It was now put together in warp speed. Go ahead.
Yeah, for sure. And so, exactly as Dr. Curnew said, we're going to be just going into how this virus basically creates symptoms, and then we're going to be talking about the vaccination. So, to start off, basically, you're going to have the virus, and it's going to enter the host cell through this receptor called an ACE2 receptor. And once it does that, it's going to basically hijack the host cell's, almost, it's like machinery to replicate itself. And so, it's going to go through a lot of replication, and in the process, it's also going to damage the cell itself. And so now you're going to have these damaged cells, and what does a damaged cell do? It's going to try to repair itself. And to do that, it's going to release a lot of things called cytokines and interferons. And at the same time, it's going to lead to a lot of inflammation. I know that this is kind of seems like a lot of information at once, but just know that the inflammation is what causes the release of the immune cells to come in and to help it. And the immune cells are basically going to signal cells around it to increase the defenses up, because the body knows something's wrong. And when this is going to be happening, you're going to stimulate what's known as a nerve ending in your lungs. And this is going to basically lead to that first symptom that we often see, which is coughing. Now, I want to kind of reiterate one important fact, and that's that usually with COVID-19 patients, they get better before they get worse. And this is because you have an initial phase of the infection, and then you fight off the infection. But then, what happens is sometimes there's something called the cytokine storm. And what this is that basically your immune cells are going to overdrive. Instead of just fighting off the infection in a normal, healthy way, they kind of go almost insane level. And what they end up doing is, instead of just being healthy, they cause more inflammation, which can actually lead to becoming something that's very fatal to the human body. And essentially what really happens is that the amalgamation of, all these symptoms and things like that is what creates something called ARDS, which is known as the acute respiratory distress syndrome. And what really happens is basically when you have these immune cells, they're going to bring in more immune cells to try to help the cause. And when they do this, the vessels, the blood vessels themselves become more permeable. And so now you're going to have this fluid that leaks out of the blood vessels and into those injured air sacs. And here you can see kind of on the left side what a healthy air sac looks like. You don't see any of that fluid or anything like that. And on the right side, you can almost see it looks like a traffic jam has occurred. You can see a lot of that kind of pus that's building up. And it's known as something called a pulmonary edema. And basically this is just excess fluid in the lungs, and when you get the fluid in the lungs where air should be, it's going to become a lot harder to breathe, right? And this is what leads to those, shortness of breath and those low oxygen levels. And once this occurs, you're also going to release all these, immune cells and helper cells to try to help fight off the infection, and that's where that fever is also going to come in. And so I see that all these kind of symptoms are coming on through kind of like a very systematic approach. Usually, what we notice is that from the people that do catch COVID-19, 80% of patients will, have mild infections. 15% will have something that's pretty moderate to severe, and then 5% will have life-threatening symptoms. And these are things like respiratory failure, shock, multi-organ dysfunction. And right now in Canada, the mortality rate of COVID-19 is 2.5%. So you might be asking, okay, that's pretty interesting, but you might want to know what type of risk factors lead to that increased mortality. And there was a really good study done out of Maryland, out of the School of Medicine in University of Maryland. They looked at over 60,000 patients, and what they noticed is that men actually had a 30% increased chance of passing away through this virus. And they also noticed that in hospitalized patients, those that passed away were usually obese, had hypertension, and also had poorly managed diabetes. Okay. And so, you might be wondering where and
Let's just pause for a second here. So here's what we do know. Is that first of all is that the mortality from COVID has been reduced in North America compared to the start of that pandemic. Why? Because physicians and healthcare teams have learned how to treat the disease better. So that's just good medical therapy. We're also learning what works or doesn't work. And really the most effective way of treating COVID is to prevent it from happening or decrease the severity of diseases. So the way to prevent it is basically isolation, those social rules. Number two is that vaccinations, we'll show you how effective it is, and you can decide if it's right for you, the actual side effects and what the risks are. But you can see that, there are people that are asymptomatic, and there's people that will have life-threatening disease. And part of the problem is that we can put people into categories. So same thing is that what very interesting is that the diseases that kill heart disease, same thing happens with COVID as well. So you mentioned diabetes, high blood pressure, cigarettes, being overweight, congestive heart failure. These are all things that unfortunately work hand in hand. And we also know that if you have heart disease, you have a heart attack, and you have COVID simultaneously, you have a 1-2 combination that has extremely high mortality. And so one of the things we need to think about is that COVID is just one spectrum of disease. And any infectious process, we know that people who get influenza, for instance, will have more heart disease. And we know that people that are vaccinated against influenza have less heart disease down the road as well. And anything that makes your immune system dysfunctional, so for instance, you mentioned being overweight. Having a body mass index over 25 causes your body to have lots more inflammatory cells in disarray, and that causes a problem. It's kind of interesting that women, for instance, have a less mortality from COVID compared to males, but women have a more chronic disease, the so-called fatigue, the lack of energizing and things of that nature. So we're just discovering so-called the chronic fatigue syndrome, what we saw before. So we're going to learn a lot about, the COVID vaccination has always taught us how to treat cancer better. And by looking at viruses in general, we're going to actually have a better understanding. Myself, as a simple cardiologist, I become very interested in the immune system, and I become very interested in different ways of prevention. So vaccinations in general, preventing infections, makes you live longer, probably less cancer, less heart disease, and less complications from just infections in general. Go ahead.
Yeah, exactly. And one way of obviously stopping the spread is by finding out if you yourself have it and then isolating. And so one of the biggest questions is, how do I know if I need to go get tested, or where do I go get tested? And I think the government in this regard has done a pretty good job with a very simple self-assessment. All you have to do is go to this website right here. You can even just search up Ontario COVID self-assessment on Google. It'll be the first thing that pops up. And then you just scroll down, you'll see a website like this, you scroll to the bottom, and you click Start Assessment. And they look at several things. So they look at, first of all, your age. They look at the first 3 digits of your postal code, and they aren't trying to track you or anything. All they're trying to do is just look at your area that you live in and see if there's a lot of cases in the area you live in. Then they ask for your symptoms. They ask for any risk factors that you might have. And again, this is kind of as Dr. Curnew was alluding to, things like obesity, hypertension, strokes in the past. All of this stuff can kind of, change the way whether you need to get tested or not. And then they also look at your travel history, who you've been in contact with through the COVID Alert app, and also if you've been in contact with someone that's positive. And based on all this information, they'll give you a likelihood of should you go get tested or not. And if you do need to go get tested, they'll tell you exactly where to go get tested. They'll be like, oh, okay, this detector is 1 kilometer away from your house or your region that you pointed into, and you just go and get tested like that. And it's very, very self-intuitive in that regard. So this is definitely something to just keep in the back of your mind, I would say. And then you might also be.
Sorry, it's Rami. It's Rami, the pharmacist, just the neighbor of Dr. Curnew down. How are you? Can I just add one thing regarding the self-assessment, if you don't mind?
Of course.
Yeah. So there is also the asymptomatic testing, which is done through some of the pharmacies. So people who are asymptomatic, they can get tested at some pharmacy locations through also the same way. They just need to select which pharmacy that does this, and they can go through the process, and then they will receive a phone call. Asymptomatic testing is valid for people who are visiting seniors, who are also working with senior homes. I encourage also people to do the asymptomatic testing whenever it is valid. So thank you, Nermin. Thank you.
No, thank you for that addition. That's something that's also really great to look at, because you're definitely right with that. Because usually right now the tests are only given to individuals that either do have symptoms or are working with seniors or have some sort of indigenous heritage. And so that's something that's also great to look out for, and a great valuable resource that we should be able to use.
So that was Rami. Rami's our local pharmacist at Shoppers Drug Mart here in the building. Our office, as you know, is in the Shoppers Drug Mart Plaza. And what I've learned over time is that getting information from multiple places, multiple sources, but basis on science. So I trust Rami's judgment. I remember when we had a contamination with Divan way back when. You were very helpful at help sorting out the problem, informing patients, and being part of that. What you need to do is put your healthcare team together. What I urge people, and I'm going to end with, I have a dream. And my dream is that we do things better and more collaboration, and how working together. So this work that we're doing together is all a collaboration, and you need to be mindful that there's so much misinformation, so much information that's changing, and you need to go the best which you can from science and keep learning forward. So I thank Rami for coming on today. We're going to have some more questions for you in a few minutes about some other things too, Rami. So hang on there. Thanks.
Yes, for sure. And the other thing that we're going to also look at in just this part of the presentation is just the long-term effects of the disease. And definitely more studies need to come out. This disease has only been around for a year and a bit now. So we'll be looking into these long-term studies. But so far what we've noticed is that things like coughing, fatigue, shortness of breath, and joint pain are reported much, much longer. So they'll be reported, even though you might only have been tested positive for 2-3 weeks, you might still see some of these symptoms months down the line. And it's kind of concerning, because what we have seen in several autopsies and in also in several kind of cases is that there has been some long-term damage to the heart and the lungs. So with the lungs, you might see scar tissue kind of being created where those air sacs were. And when that happens, you're going to basically be a lot more prone to getting pneumonia and things like that in the future. And in addition to this, we've also seen that some people have seen in the long term decreased ejection fractions, arrhythmias, some sort of cytokine storm for heart muscle, and all of this usually happens with advanced cases or severe cases of COVID-19. But basically, when the heart becomes enlarged and weakened, you can see low blood pressure, and then you're also going to see fluid in the lungs. And so that's also going to exacerbate the disease itself and cause that shortness of breath again.
So COVID is a disease that affects multiple organ systems, and one of the things we're discovering is that this so-called brain fog that people get, it may not represent severe disease presentation, and it tends to be. It looks like it may be more common in people who have less severe disease. So if you're a young 30-year-old individual or 20-year-old individual, you may sail through your COVID infection, but develop these chronic long-term effects, and how common and how best to treat them. We're still learning about this. Also, on autopsies of the brains, there's these microinfarctions, because one thing that COVID does do, it causes blood clots to form both on the arterial and the venous side. And so that may be something that we have no way of properly imaging these microinfarctions that may cause the fogginess and things of that nature as well. So you can see that we have a lot more to learn. And the best advice is to try to not get the disease, and not find out if you're going to have if you're going to be asymptomatic, acute symptoms, or chronic symptoms. And so let's hear some more about staying at home.
Exactly, and so the best way to fight this is isolating yourself, staying at home. And we got the new stay-at-home restrictions, and so this is for all of Ontario as of January 14th, midnight, essentially. This basically means you have to stay at home unless, there are some necessities that you can leave your house for. And I've kind of listed all the ones that are here. And so you can see that there's not a lot of reasons why you should be leaving your house. And the main thing is, stay home. Just try not to get the disease, because if you do get the disease and you have to go to the hospital, you're going to overwhelm the hospitals, and it's kind of just going to kind of prolong the entire situation. So staying at home is the best thing that you can do. And we can talk a little more about that. Yeah.
Interesting is one of the things is getting exercise. To me, if you look at the stress that people are under, the best stress reliever so far is exercise and being outside. So I'm still going outside and doing my exercise. And I do the Chinook stairs. I ride my bike. I fall off my bike in the icy weather a little bit. Got to be careful about that. I really got my weight in order. I'm still fighting this as well. So I want you to find ways to be safe. And you're absolutely right, is that this virus can easily go away. If everybody just stayed in one place for about 3 weeks, the virus would disappear. We don't do this in North America very well, where some of our Asian colleagues or Australia, they've done a much better job of proper isolation and more respectful of the community versus individual rights, and done a better job of putting the virus at bay. So we can all do better, and we should do better, and we will do better, I'm sure.
Alright, so I think, Jenny, you're going to introduce the COVID-19 experience, right?
Yep, so this is it's a family of patients, one of Dr. Curnew's patients, and in October of last year, so 2020, they tested positive for COVID, and you can move on to the next slide. I didn't get a chance to speak with them directly, but Dr. Curnew, did you want to sort of elaborate on this further?
Sure, you always find out these things by accidents, and this is a wonderful family, and I'm going to let Andrea tell her story first, and I'm going to say some words after, so I'll tell the medical part, but more importantly, this is a human story, and this reminds me of how good things or bad things happen to good people, and we carry guilt that we should not carry, so Andrea, I'm going to say a few words, and I'm going to say a few words afterwards. So why don't you tell us your story?
Hi, Dr. Curnew and everybody else online. It's not Andrea, it's actually Lisa speaking.
Sorry. Go ahead, Lisa.
Can you hear me?
Yeah, we can hear you.
Okay. Yes, all four of us had tested positive with COVID-19 in October of last year. Unfortunately, Dad passed away from it. I had contracted COVID-19 at work and brought it into the house not knowing. And prior to going to work, I had said to my boss in the springtime, my worst fear is catching COVID and giving it to my family. Well, unfortunately, it came true. We all seemed to have mild symptoms. Lisa, was very tired. I had a fever for a little bit, but nothing major, a bit of a dry cough. Andrea, my sister, she had one day basically, she couldn't taste anything, but otherwise she felt fine. Mom, Jeanette, she sounded like she had bronchitis. She had a terrible, terrible, terrible hoarse cough, and it lingered on until November, middle of November, end of November. Dad, Joe, he had a bit of a dry cough like myself, but otherwise was fine. And I would say about a week after testing positive, he said his chest was a little sore. He wanted to go to the hospital. We brought him to the hospital. He was admitted into the COVID ward at the General, at which time he was doing good on the Wednesday, Thursday, Friday. The Friday, the doctor said to me, we're going to send him home tonight. And my question was, can you get him up and walking a bit? Because he hasn't walked. I want to make sure he's strong enough that he can do the stairs at home. So the occupational therapist came in. She got him up walking, and she said, well, let's give it a day or two. I said, yep, no problem. We're good with it. I went home. I called the hospital 11 o'clock that night, and I wanted to know how he was, and the nurse said to me, he's on 40% oxygen. I was extremely puzzled, and I said, are you sure? Like, if you got the right person, it's Joe Partito, it's this bed. Yes, I am. So the next morning, I went to the hospital, and the doctor, on staff, the same doctor, he said to me, Lisa, things have turned for the worse. This morning at 4:30, he had a seizure. My dad never had a seizure before in his life, and he's moving into ICU. So he went into ICU, at which point I could not go into the room because of the COVID, so it was an enclosed glass room that you see on the news, and I was in the hall, and he was conscious at that point and was waving to me to come in. Well, that broke my heart. I couldn't go in, obviously, so I said to the doctor, I think it's best if I leave for him and for me, and I left. So on the Sunday, they told us not to come into the hospital. He was doing okay. He was on 50% oxygen, but he wasn't eating. Well, Monday morning, the doctor in ICU called and gave us the bad news. His exact words were, your father's dying. He's on 100% oxygen. Well, at that point, my sister hadn't been released from public health. Her dates were mixed up. So our question was, will he, can we wait until Andrea is released and then all three of us can get to the hospital? And the doctor assured us that he wasn't in pain, that we should be fine. So Tuesday morning, we went to the hospital Monday, myself and my mom. Dad was unconscious. He didn't even know we were there. And then Tuesday morning, the same doctor called to say, you guys need to get down here. He is slipping into palliative care on his own. So we went to the hospital. The staff was fantastic in both the COVID ward and ICU. The doctor assured us that if we watched him pass, it wouldn't be something that we would, not want to see, like gasping for air or anything. So we agreed to watch. He did tell us once they release the oxygen, some people it can be anywhere between days, hours, or minutes. In our case, it would be minutes. So as I recall, on October 20th at 2:19, the nurse went in, released the oxygen, and at 2:29, the monitor went off, and Dad passed. So it was very quick. He passed peacefully. It looked like he was sleeping. And when we saw him at the funeral home, he looked at peace. But, so many people don't realize how serious COVID is and how dangerous it is. And, it's not a hoax. It's nothing fake or anything. It's real. And it does happen. And I think some people, I don't wish anything upon anybody, but until it hits home, you don't realize how serious it is.
Thank you for sharing that story. Lisa, is that any other messages you want to tell people?
Well, my message to people is, like you guys have been saying, stay home. You know what? Stay home. Listen to what you're being told by the authorities. And if by any chance you're not feeling well, don't go out. Do yourself the favor. Do not go out, because I had no idea It started on October, it was Saturday, if I recall correctly, it was October 3rd. I thought I had a bit of a dry throat, and it was because I hadn't drank my water that day. Didn't think anything of it. Sunday I felt a little sluggish. Still didn't think anything. Monday I woke up and I thought, oh, you know what? It's change of season. Maybe it's my allergies. Still nothing. And then I said, you know what? I better be safe. I better go for a test, a COVID test. And my mom, my dad, my sister were still fine. On the Tuesday, my dad started to develop a little bit of a tickle in his throat, just like myself. And then Thursday, my mom woke up and she was coughing, and she called her family doctor, and he said to go to the hospital. And she took Dad along just because she was going, and we found out they were both positive on Friday. So you know what? It's not worth. I did the best that I could do. I had to go to work. The only other option I had was to take a leave of absence. Now today, I carry a huge amount of guilt. Not only am I grieving, but I carry the guilt of if I wouldn't have gone to work, this is my fault this had happened. And it's hard. It's really hard. Because if anybody would have told us that Dad was going to the hospital and was never going to return, we wouldn't have believed it. And I know death is inevitable, but there's times like this, how this happened, this is what really, it's holds a heavy weight.
Lisa, thank you very much for sharing this. And I would probably feel exactly the same as you do, but there's no reason for you to feel any shred of guilt. But we're human, and I will do my best to hit you, slap you around, get that guilt out of you in any way I possibly can. Because you're a caring, loving individual who can see that the disease spreads quite quickly and rapidly. And that's why we need to think about how to treat and understand this disease better. Now, it's interesting from a medical perspective, Lisa, you're overweight, and I would have predicted to have more severe complications. Andrea, I know quite well, is that you do the should go stairs faster and quicker than myself. I would have predicted you would sail through. Jeanette, your mom, she has bad congestive heart failure. I would have predicted a very bad outcome for her. So was a sick gentleman with lots of illnesses, from Parkinson's to other medical problems, and was very weak and frail. I would have predicted a bad outcome. You can see, so we can put people in boxes. But what I also know is that I'm always amazed, and trying to predict the future is very challenging, but we can stack the odds in one's favor. And one of the questions you'd be asking yourself, can I get this disease again? Should I get vaccinated? And we'll have more answers to that as time goes on right now. But I think what you did today was very brave, and I thank you for sharing that, because this is real. I want to cry.
Yeah, you know, it's my pleasure. My pleasure. If I can help somebody else through a real experience, and it's going to help people and convince people, then you know what? I'm totally for it, because nobody wants to go through what we went through.
And let's show the next slide here. And why don't you tell us a couple of things about your dad?
Like personality-wise or health-wise?
Well, just tell me just little things that you want to remember and what you want to share.
Oh, my dad was a very kind-hearted, loving person. He always put others in front of him. Others came first. And I know for myself and my sister, both my parents, for us growing up, they did everything in their power to make sure we were comfortable. If they had to go without, they went without. If my dad had to work 3 jobs so my mom could stay home, he did. I know he did, for a number of years. So they were wonderful people. My mom and my dad. And I know today my dad would say, don't be upset with yourself. It was my time. He was a firm believer that everybody has their time, and when their time is their time, there's nothing they can do.
Thank you very much. So you can see how how one disease can affect people in different ways, and from emotionally to physically. And then we have to learn about the long-term sequelae of this. Is that disease injuries that one gets to one's lungs or immune system, do they make us stronger or weaker? And to me, is that every insult to the body has potential for weakening, but also too is that we can get ourselves stronger and healthier. So again, my dream for everybody is to use this opportunity to grow, to use science and get healthier. And if we can help in any small way, we will. And again, we are deeply sorry by your loss. Excuse me. Thank you.
Thank you. My pleasure.
So this is at a town hall meeting that just took place a couple days ago. And the head of cardiology here at McMaster, Dr. Healy, said, we heard what happened in Italy, we heard what happened in New York. It looks like it's going to happen in Hamilton and in Canada. And I don't know if this is going to or not, but you can see the disease is accelerating. And there are so many things you can do right now to get yourself healthier, get yourself in better fighting shape. And we're going to talk about what you can do today and what you can do tomorrow. Let's go to the next slide. Who's going to talk about this part?
So Frank, I think you can take it away.
Yeah. So as we all should know at this point, like one of the first lines of COVID protection is through prevention, and one of the main ways that we can prevent ourselves from getting COVID and spreading COVID is through social distancing. So social distancing means keeping a safe distance, typically 2 meters away, between yourself and others who are typically not part of your household. And I just want to bring attention to the first figure on this slide here, where you can see a curve that's being flattened, and that idea of flatten the curve has probably been thrown around a lot. And I just want to explain that flattening the curve basically shows what happens when we can slow the spread of the virus down through effective control measures. And that basically means that even if the same number of people get sick, we can spread it out over a longer period of time so the hospitals are less overwhelmed and we can better treat and deal with the COVID-19 pandemic that's happening. And while social distancing, we all have probably heard of social distancing and understand it, I think something that's a question that comes up sometimes is how effective is social distancing really? So I want to draw your attention now to the second figure, which is the results from research with a computational model, which has actually demonstrated that in a society with school closure, quarantine, as well as workplace distancing protocols, you can see a severe reduction in COVID-19. You can see, for example, if you have a 90%, you can see a 90% reduction in COVID-19 when you have all of those protocols implemented. But if you're looking for something outside of a computer model, there have been a lot of other epidemiological observational analyses of COVID-19, one of which found that there was a 29% reduction in people getting COVID-19, as well as a 35% drop in COVID mortality when you put in these quarantine and social distancing warnings that are issued by the government. And there's a lot of other research out there that will tell you how effective social distancing is, and I encourage you guys to all contact the clinic if you're interested in learning about that more. Also, as a bit of a tangent, COVID-19 and quarantine and social distancing, it's not necessarily always the most appealing thing to do, because that means that you're restricted a lot by these rules and regulations from things that you typically want to do. So I think it's also important to understand that you need to take care of your mental health, because studies have also shown that there have been increases in generalized anxiety disorder as well as depression that have been associated with the pandemic. And to prevent this, I want to share a piece of advice that I actually found as like a study title when I was looking at research. And it's the COVID-19 pandemic calls for spatial distancing and social closeness, not for social distancing, meaning that you want to spatially distance yourself, but not necessarily, you want to keep on maintaining those social connections that you have. And the next line of defense that we really have for COVID-19 is mask wearing. And it's common knowledge nowadays that like masks are effective, and that there have been a lot of observational studies that indicate that mask wearing is effective. And we'll go through some of these studies a little more in depth later on. But interestingly though, there have been recent randomized controlled trials that have begun to suggest that the materials of masks really matter. And we'll go into this a little bit more in depth as well. But a study actually demonstrated that wearing cloth and surgical masks in public actually did not reduce COVID-19 rates among wearers by more than 50% in a community that has modest infection rates. But masks like the N95, however, were demonstrated to be more effective in blocking out SARS-CoV-2 particles from spreading, with over 90% filtration of particles smaller than 0.3 micrometers. But when you're considering your mask choice, you have to be practical, because most people don't have access to an N95, and we need a lot of these higher grade masks for people who are working in healthcare settings. So surgical and cloth masks are still really effective solutions in reducing COVID transmission. And just some tips that we'll go through later as well. When using a mask, just be careful that your mask fits really well and has 3 layers of fabric. All right, and we're just going to play a video here that demonstrates wearing a mask versus not wearing a mask. So this is an animation of a study produced where they actually, you can see how the particles still linger in the air when you're not wearing a mask, and see how far it travels, right? But Nirmay, if you would skip to 154 in the video, please. Perfect. So this is a demonstration of if you are wearing a fabric or a cloth-based mask. And then if you could skip to 211. Oh yeah, perfect. So this is going to be a demonstration of what happens when you wear a cone mask, and you can see the particles travel a lot less distance. And then if you could skip to 224. Oh, there we go. And this is a non-medical surgical mask, which is commonly what we see, and you can see how that also reduces the particle transmission.
Okay.
So it's very interesting about these masks here. So masks are designed to prevent you from infecting other people. I'll repeat that. The number one reason for wearing a mask is to prevent you from making other people sick. And that's what they're designed for. When surgical masks were first designed for surgeons, it was so that surgeons' sweat within their nose didn't fall on their patients. That was the purpose of the mask. We'll show you a randomized trial in a few minutes about what does it provide you any protection. So to me, if someone says, I don't want to wear a mask, it means if you carry the disease, you can be potentially infecting somebody else. And the reason to wear the mask is that you don't make other people sick. And many of the diseases are asymptomatic, or starts off that way. So please think about what you are doing. If you say it's my right not to wear a mask, or I cannot wear a mask, you're giving yourself the right to kill somebody, and decide if that is the right choice for you or not.
Okay, on the topic of masks, I think things like proper material, structure, and fit are factors that we need to consider when we're wearing face coverings that can help to prevent the spread of these infectious diseases. So I know I've seen a few patients in the clinic who make their own masks at home and sort of use their own fabrics and their own designs. These are just a couple things to keep in mind. So they should be made of at least 3 layers. So 2 layers should be tightly woven material like fabric. And the third or the middle layer should be more of like a filter type fabric. And so there's an example of that there. And these are 2 images provided by Dr. Curnew, which I thought were quite funny. So you can move on to the next slide. And for this slide, we'll be discussing the randomized control trial that Dr. Curnew just mentioned. So this is an RCT that looked at whether wearing surgical masks outside of the home reduces the risk for the SARS-CoV-2 infection. And this is in a setting where masks were uncommon and they weren't among the recommended public health measures. So the participants included adults who are spending more than 3 hours per day outside the home without a mask. And in total, we had around 3,030 people who were randomly assigned to wear masks outside. 2,994 participants were assigned to control or not wearing a mask. So as you can see in the chart that I've provided, the infection with the virus occurred in 42 patients who were recommended masks, which is around 1.8%. And while there were 53 participants, or 2.1%, who were infected. So it was concluded that the recommendation to wear the masks, and this was in supplementation to other public health measures, the infection rate among wearers were by more than 50% in a community with modest infection rates were actually not the case. So with some degree of social distancing and uncommon general mask use, the data was actually compatible with lesser degrees of self-protection. So you can see there were inconclusive results, some missing data. So like any other study, we need to be critical. And so if you go to the next slide, I'll be discussing the limitations.
Go back to the slide a little bit there. So this was actually done in Denmark between April 3rd and June the 2nd. So it was done at a time when this was relatively early on, where people in that country weren't recommended to wear masks or weren't wearing masks in a way. So, and the results were, again, 6,000 patients in a randomized trial. That's a huge trial. And we'll talk a little bit some of the details about this, but the results were a non-significant reduction in you becoming sick by just under 19% or so. So to me, the reason to wear the mask is to prevent you from spreading the disease, and there may be a small benefit of preventing you yourself from getting the disease. So one thing to remember is that if you're relying on the mask to prevent you from getting the disease, you don't have a very good tool. Next slide, please.
So there are a couple limitations to this study. Well, first of all, at the time, there was actually minimal community transmission, not like there is today. The healthy volunteer effect is actually when you're taking participants who are in fact healthy, so you don't see as beneficial results for people in real life, as not everyone is healthy, right? So there was also no blinding. So if you were recommended to wear a mask or not, then you knew. And there was actually poor compliance or poor use of a mask. So 47% reported partial use and 7% reported no use. So yeah, the bottom line is that masks on a population level have very unclear effects, and likely more source control protection for society than personal protection is recommended.
So this is actually a good starting point here. So I think we should all be wearing our mask, and as we first pointed out, you can see that the amount of secretions that are aerosolized by wearing masks make a difference. There's less particles going out there, and they don't travel as far. So if you're coughing, for instance, they go further. If you're sick, they're going to go further. There's going to be more. So this magic, couple feet, things of that nature is important, but it's not magical. These particles do stay around, and they stay around for periods of time. And how long they remain infectious is very interesting. You can show particles of COVID being around in 2-3 weeks later, but they're dead particles, so they're not going to be infectious at this point in time. The number one way of transmitting disease is by secretions, aerosolized secretions. Yes, you can get it by contact, and what happened initially in China and in Italy, the place that transmissions took place were actually in the hospitals, were in the bathrooms, were in the lunchrooms, where staff got together, maybe a little bit too closely, and they didn't always wear their protective gears and things like that nature as well. So this study does not say, this study was designed not to show whether or not you prevent spread of disease, it was whether or not you can actually catch the disease. So to me, this is actually a very important study that to me suggests that if you use these masks properly, you may be able to protect yourself to a small degree, let's say 20% or so. This is the best randomized trial we have so far. It's a p-value that's non-significant, which means that it could be by play of chance. But this is actually a very good starting point, and wearing good masks, make sure that you change them at the right times, keep things clean, and wash your hands a lot, social distancing. But the masks do have a role. This is what's been shown to do so far.
Okay, so I'll be talking next. I'm just going to go over a little bit about the history of vaccines. They haven't been new. They were used actually successfully long before it was even understood how they worked. So it's been documented as early as 1796, where British physician Edward Jenner successfully tested the first smallpox vaccine by injecting a young boy with a milder smallpox-like disease that typically affected cows. And this carried on to the modern science of vaccination, which was developed by Louis Pasteur. And Pasteur developed vaccines in his laboratory using the same agent that caused the disease, starting with the cholera vaccine. So as you can see from the image on the slide, vaccines have been documented as early as the 1900s, all the way to 2020. And human trials have also started in 1900 with the typhoid fever, to now with the coronavirus in present day. And then if you could go on the next slide.
Actually, if you can just go back one slide a sec. I'm going to ask Rami a couple questions here. So, Rami, you're our expert pharmacist, and I really appreciate your healthcare team. Can you tell us a little bit what vaccines you have available and what some of the vaccines you recommend for people to think about? I wonder if Rami's still here.
No, I'm here. So yes, it depends. Of course, depends on the difference of the age, of course.
So we're going to the adults, over the age of 50 years of age.
We're referring to all types of vaccines. Yeah.
That's right. Just get a little. We're going to do a whole webinar on vaccines, but I just want to give people a little flavor what vaccines are available for people over the age of 50 years of age and what they should consider.
Yes. So I have actually. 1 second. I'm gonna. For people with over 50 years of age, I would definitely recommend strongly to redo a booster for their tetanus, diphtheria, and pertussis, because these are always every 10 years, and in many cases people miss to boost themselves every 10 years on those. There's also the pneumococcal. This is now even over the counter. You can buy it from the pharmacy, and you can actually get vaccinated by the pharmacist there. Shingles for people between 65 and 70. These are the main ones I would recommend. If people are traveling, I would definitely recommend that if they never got their Twinrix, which is hep A and B, I definitely recommend this strongly. So we're talking about 50 plus, as you said.
So what's interesting is that we never forget our yearly influenza vaccines. So it's been actually shown that people who get immunized against influenza, which is also coronavirus, have less severe disease and also have a reduction in mortality because it decreases inflammation. I remember when I was an intern, we saw some ravages of HIV and hepatitis B. We all got vaccinated against hepatitis B, so that's a disease that can be treated. And people have shingles. Shingles can be a very, very painful condition, so that can be looked at. And also pneumococcal pneumonia is a pneumonia. It's also called the mortalities are higher in older individuals. So you can see that vaccines have a long track record, and diseases such as polio, smallpox have been eliminated. So we have a really strong history of vaccinations showing benefit. Thank you so much, Rami, and thank you so much for sharing that. Next slide.
Okay, perfect. Right, so while explaining how vaccines work, it's first and foremost important to look at how our bodies fight the illness, which is where the immune system comes to play. So when germs such as the virus that causes COVID-19 invade our bodies, they attack and multiply. And then this invasion, which is called an infection, is what causes the illness. Different types of white blood cells fight the infection in different ways. So there's macrophages, which are white blood cells that swallow up and digest the germs, and also dead or dying cells. And the macrophages leave behind parts of the invading germs, which are called antigens. And the body identifies those antigens as dangerous and then stimulates the antibodies to attack them so that you're healthy and safe. We also have your B lymphocytes, which are defensive white blood cells. They produce antibodies that attack the pieces of virus that were left behind by the macrophages. And the T lymphocytes, which are another type of defensive white blood cells, and they attack cells in the body that have already been infected. And then next slide, please. And advances in virology, molecular biology, and immunology have also created many alternatives to the traditional vaccine. There's many types, but I just wanted to touch upon 3 here. So we have the mRNA vaccines, which includes the current COVID, Pfizer, and Moderna vaccines. So mRNA vaccines contain material from the virus that causes COVID-19 and gives our cells instructions for how to make a harmless protein that is unique to the virus. And after our cells make copies of that protein, they destroy the whole genetic material from the vaccine, and our bodies then recognize that protein as a threat and that it shouldn't be there. So they build T lymphocytes and B lymphocytes, which I mentioned on the previous slide, that will remember how to fight the virus in case you are infected in the future. There's also vector vaccines, which contain a weakened version of the live virus, and it's a different virus than the one that causes the COVID. So this prompts our body to, again, build T lymphocytes and B lymphocytes that will remember how to fight if infected in the future, and subunit vaccines, which are harmless proteins of the virus that causes COVID-19, but instead of the entire germ. And once vaccinated, our immune system recognizes, again, that the proteins don't belong in the body, begin making the T lymphocytes and antibodies, and again, if you're ever infected in the future, it recognizes it and fights the virus. Next slide, please. That being said, there are also some facts I wanted to share from CDC, so the Center for Disease Control and Prevention, to clear up some misinformation that's been going around. So 1, COVID-19 vaccines will not give you COVID-19. 2, COVID-19 vaccines will not cause you to test positive for COVID-19. 3, people who have gotten sick with COVID-19 may still benefit from getting vaccinated. 4, getting vaccinated would actually prevent you from severe illness, complications, and death. 5, receiving an mRNA vaccine, which are the ones that are available right now, will not alter your DNA at all. And 6, mRNA vaccines are not actually able to modify a person's genetic makeup. And the next slide, please. So how do mRNA vaccines work? So COVID-19 vaccines, like the Pfizer and Moderna vaccines, help our bodies develop immunity to the virus that causes COVID-19 without actually giving us the illness. So with an mRNA vaccine, a person receives genetic instructions that are injected into their upper arm. The muscle cells then translate that and make viral proteins directly in the body. And then the vaccine gives the immune system a preview of what the real virus looks like without actually being infected. and then the cells read the information in the mRNA sequence to produce millions of spike proteins. And finally, the proteins would then spur the immune system to produce antibodies to neutralize the real virus if the individual is ever infected in the future, so it is completely safe. And yep, that's the end of that slide.
Should I talk about this, or someone else want to talk about this?
I think Nurme,
I can talk about this if you like, if you're in trouble. So basically, Nurme, are you going to be talking about this? You want me to talk about this? Okay, so what we have here is two phase 3 large randomized controlled trials, the Moderna vaccine and the Pfizer vaccine. First of all, look at the sample sizes. The Moderna, 30,000 individuals. The Pfizer vaccine, 43,000 individuals. So these were relatively healthier individuals, some older, some younger, but these were the healthiest of all. The Moderna, you had the second injection at 28 days, and the Pfizer was recommended at 21 days. Now, I must stress is that when people get vaccinated in real life, they never exactly follow exactly what you're supposed to do. I don't know about you, when I come to a stop sign, I sometimes have a rolling stop, and I don't come to 100% stop. I got tickets for that. So you have to be careful. You want to reproduce the trials as much as you can, but we learned a lot along the way. So first of all is that these undertakings are huge. And to do a clinical trial of this magnitude in this time frame of less than a year, 43,000 patients, that means half got the vaccine, half got a fake vaccine, or just basically saline, and 30,000 Moderna vaccine, you can see that there's some local reactions that took place, some aches and pains, and quite a bit of that. That means that when you get the vaccine, you're actually getting your immune system to work. As we just learned before, is that what the vaccine does, it trains your body to basically fight the infection, a particle of that infection. So the body recognizes the spike protein as being foreign, and it develops an inflammatory response against that. Next slide, please. And one of the things is I learned from multiple sources. This is Dr. George Chow, who's involved in lifestyle medicine now. I love listening to this gentleman talk, because they really much are individuals that talk about lifestyle changes. And I listened to his webinar, and I encourage people to look at that. So this is a lifestyle approach from plant-based eating to good taking care of yourself. But they'd actually reviewed the vaccines just last Sunday, and I'll show you some of the slides that he did. He did a wonderful job. So next slide, please. I want to give him credit and learn from multiple sources. First of all, the most prestigious journal is the New England Journal of Medicine. So this is front page, and you can see the brain power behind the development of the vaccines is phenomenal. Science has come through loud and clear with the best minds, the best collaboration, and let's see what the results were of what took place. Next slide, please. And the vaccine is quite simple. It's just, so RNA stands for you have your DNA that goes into messenger RNA, which is one copy of that. And so what happens is that what they did was they developed a messenger RNA, and they just put it in sort of like a little bubble, this glycosylated, really very not much to it. So very simple vaccine. It's just a little vehicle that gets a messenger RNA into your body. Next slide, please. So nothing very complicated, nothing very sinister. And remember, as pointed out, is that when you get the vaccine, you're not getting the virus, and you're not getting the disease. You're getting a copy of genetic information, which your body is now going to start to use to develop immunity. Next slide, please. And so what happens is the RNA signals that we're going to make the spike protein. in your own cells. So first of all, for the virus or for the vaccine to work, is that you need your immune system to work. If you don't have an immune system, giving you the code to make the spike protein will not work. And so you're just using machinery in your body to develop immunity. Next slide, please. And that's what the vaccine does. And it creates these spike proteins in your cells. Next slide, please. And the body recognizes these spike proteins as being foreign. And you start to develop immune response with both T and B cells. So this is your body's defense mechanism. We have initial inflammation that takes place, and then you have the super killers, or the super parts of your body that come into play to develop stronger ways of attacking the virus. And so this is what happens. So you're stimulating your own body through the vaccine to develop an antibody results right now. It's one of the things is, why don't I just give you infusion of convalescent plasma cells and immunology from other patients. So the first large randomized controlled trial, 700 patients, showing that convalescent serum does not protect you. I'll repeat that. Giving convalescent serum at this point in time in a randomized trial so far did not provide protection in very severe patients that were sick in the ICU. So that comes as a surprise to many of us, but that's what the results of that clinical trial so far. And we're going to learn more about that. There will be other clinical trials in that area. So what you're doing right now is that you're stimulating your immune system to develop antibodies. So if you do get COVID-19, you have an immediate attack against the virus. Next slide, please. And the virus is quite a simple virus, but what a virus wants to do is invade your cells and destroy your tissue and takes over your own machinery. What you want to do is develop your immune system to fight that virus very quickly by developing these antibodies and putting that virus out of your system very quickly. Next slide, please. And these are some simple things, is that we want a simple approach, but you can see the immune system is quite complicated. And again, you need your immune system to work well. Next slide, please. Now, what we expect. So point one is the vaccine isn't going to give you the disease. It's a simple vaccine, and it's not giving you anything but the code for your body to develop inflammatory attack against the spike protein. And what happens is, you get vaccinated, you're going to get pain at the injection site. It's going to be tender. You can see that if you get jabbed, 75% of people will have a bigger reaction compared to if you didn't get jabbed, or you get jabbed with a placebo, because what's happening is that your body is developing a fight against the virus already. So that means that your body's working. It's sort of like Buckley's. It tastes bad, it means it works. This means getting a local reaction is what's expected, and for the vast majority of people. That means your immune system is starting to work. Next slide, please. That's good. And you can see that you might get some fatigue, headache, muscle ache, a little bit of fever. You might need to take some Tylenol, some anti-inflammatories. You might get some chills. This is what's expected of that. So that's what you can see in the vast majority, or quite a few people, and that's basically expected, and that's normal. So you're not getting sick. Your body's starting to develop an inflammatory response, or starting to fight, or developing the ability to fight the virus. So it's just practicing. It's getting ready. Next slide, please. Now, what's interesting is that you can see that here's what we know in these trials. So you talk about these trials of 30,000 individuals. So in the vaccine group, you can see at that neck, you can see that people got these big lymph nodes, 64 out of 30,000 on vaccine, and 6 on the placebo. Now, lymph nodes are basically where the body stores its immune system. So it looks ugly, but it's not really necessarily such a bad thing. But this is what was noted so far. Next slide, please. The other thing too is that Bell's palsy was found in 3 people that were vaccinated, and in one individual on the placebo group. So so it looks like that this response can actually trigger some effects here. So again, here's the good and the bad, and so far the bad doesn't look that terrible to me. Next slide, please. And this is basically related to the vaccine. So we had the Pfizer at 40,000 patients. There was 4 adverse effects, and the Moderna with 30,000 individuals, 3 adverse effects that you can see here. Now, interesting is that you can see that there were 2 people that had reactions to dermatological fillers. So if you get your Botox, your injections in your face to make yourself look beautiful, the Moderna vaccine may interpret that as being a foreign substance and may attack that. It's kind of interesting. You can see it's not a big issue, but you can see what your body's trying to do is to fight what's foreign. And so there are some side effects, but they don't seem to be any major amounts at this stage. Next slide, please. So that was the bad. Here's the good, is that this is an effect on placebo, is that 162 individuals developed COVID symptoms versus 8 on placebo. And so this tells us about the 95% reduction in clinical events. Now, I'm a cardiologist, and we're used to big trials of 1,000 endpoints. So the amount of endpoints, 170 endpoints is not a huge amount. But again, these are 30 to 40,000 people being vaccinated over a period of a couple months. 162 patients on placebo got the saline injection, developed COVID, versus 8 patients got symptomatic COVID on the therapies. And this is where the number of 95% effectiveness takes place. Next slide, please. And so when we say 95% efficacy, does that mean that you're going to decrease symptoms, severity, transmission? Are you going to save lives? And so let's look at this a little bit more carefully. So 95% efficacy, what does that actually mean? Next slide, please. If you look at this again, so we have the 2 big trials. So the Pfizer trial, again with 40,000 patients vaccinated over a period of about 2 months. You can see that 162% of people who got the fake vaccine or the saline injection developed COVID, symptomatic. And 9 had very severe symptoms. In the Pfizer vaccine, again, 8 had on vaccine got symptoms, and one was severe. So what we learned from the Pfizer vaccine is that symptomatic disease was decreased, and severe disease was decreased by about 90%. With the Moderna vaccine, the same thing took place. 185 patients developed symptomatic COVID with the vaccine on placebo, and versus 11 on placebo. So you can see again a similar reduction of about over 90% success rate of decreasing symptomatic COVID and severe COVID. So next slide, please. If one now looks at what we can do, is that, well, here's what we know for sure, is that getting the vaccine over a period of 2 months will lower the chance of you getting symptoms and being very sick with the disease. It hasn't been shown to change mortality at this stage, and we don't know about whether or not you spread the disease or not. So if I get the vaccination, you may get COVID, but your disease will be less severe, but can you still transmit the disease to others? That needs to be sorted out as we go on right now. So So right now we'll still have to maintain our social distances. We'll still have to be wearing our protective gears and our masks and things of that nature as well, because conceivably you might get the disease, but of a very less severe form. And will that block transmission or not? We still don't know that for sure, but chances are it will actually decrease the rate of transmission, but that needs to be sorted out at this point in time. Next slide, please. And so if you take the Pfizer vaccine, it shows that you help decrease by about 90% getting COVID and severe COVID in a period of about 2 months from now. And the Moderna vaccine shows similar findings. There's some work coming out that the Moderna vaccine helps decrease transmission, but that hasn't been, in my mind, well validated yet right now. So we talked about the mask. Maybe you're going to decrease the amount of getting the disease maybe by 20%, but you're going to help prevent spreading disease. So the mask helps spread the disease after preventing it. The vaccine helps you from getting the disease at this point in time, and also less severe forms. And probably will translate to reduction in mortality. So that's remarkable. I would never thought the vaccine would be that effective that quickly. So a very safe, simple vaccine works wonders. Next slide, please. So you can decide about other things as well. But let's go back one slide one more time. Go back one more right now. So I think this is truly remarkable that we now have two very safe, effective vaccines. Make your lymph nodes a little bit better. There's a couple patients that did develop COVID-19 on vaccine, so it's not 100% sure of anything. I know very few things that work this well and that successfully. And to me, so far, it's been shown to be very safe and effective in over 100,000 patients that have been vaccinated. These are just the phase 3 trials. I didn't talk about the phase 1 or 2 trials and other trials right now. So the questions, there's still lots to learn about this. How durable is this? How will the disease mutate? But wow, remarkable. To me, I'll take any vaccine, anytime, anywhere. One of the questions will always come up, if I had the disease, should I get vaccinated again? That answer has not been fully elucidated, and that would be some of the talks of the future right now. But you can see that what a powerful vaccination, and wonderful. So next slide, please. All right, let's hear about vitamin D.
Okay, so until the treatment and vaccine for the COVID disease becomes more widely available, there are other methods that were explored for reducing infection rates. And so this specific study determined whether circulating 25-hydroxyvitamin D levels were associated with SARS-CoV-2 positivity rates. So there were over 190,000 patients from all 50 states with the SARS-CoV-2 results that were from mid-March to mid-June of last year. And the positivity rates were actually higher in the 39,000 patients who were deficient in the vitamin D values. This is in comparison with the 27,000 patients who had just adequate values and the 12,000 patients with values of just greater than 55. And so the association between the lower SARS-CoV-2 positivity rates and the higher circulating vitamin D levels were significant, and this is a relationship that persisted across different races, ethnicities, sex, and age ranges. So this study was really helpful in suggesting that the role of vitamin D supplementation, there is a role in reducing the risk for the COVID infection and just the COVID-19 disease in general.
Actually, let's backtrack a little bit. So this is actually observational data. Beds are associated with deaths, but beds don't kill people. So we now have one randomized controlled trial that giving people with COVID vitamin D or placebo show no value, no benefit. I'll repeat that. So we have observational data that says that people who have low vitamin D levels do worse. It doesn't tell you about supplementation. The only randomized controlled trial giving vitamin D or placebo is negative. Now, it's a small, underpowered trial, but if you're relying on vitamin D to save you, you're in big trouble. And my mind is that vitamin D, we went from beta carotene to vitamin E to vitamin C, all these vitamins to save the world. The only person that saves is the people selling you these products. There's lots of association data, but the randomized trials are negative. We also know from genetic studies that people who have naturally low vitamin D from birth do not have more severe COVID infections. So that's another hole in the in this strategy giving vitamin D at this stage. So to me is that we also recently the VITAL trial that took that vitamin D 2,000 units a day to prevent heart disease and cancer. It failed miserably. So vitamin D was a wonderful vitamin 10 years ago. It's now falling out of favor like all the other vitamins right now. We still have to learn about its role in osteoporosis and other areas, but it's not as strong right now. So to me, the data with vitamin D is not impressive whatsoever. So that's a negative trial. So basically, we learned that convalescent plasma doesn't work. All these immune modulators that President Trump and others tried and things sure don't seem to work. There's some data in some sick patients that might decrease the severity of disease in some of these immune modulators, but the only proven drug that works in COVID right now is steroids. When we met Andrea and the rest of her family before, is that unfortunately her dad died of the cytokine storm. What happened is that you had the initial invasion of the virus, and the disease calmed down, and then you had the immune system that became overactive, and we know that steroids make a difference, so Decadron, prednisone are the things that we think about. We know that good care in hospitals, oxygen, well hydration can make a difference, but I'm not impressed at all with vitamin D whatsoever. I wouldn't be using it myself. Next slide, please.
Okay, so this is to answer the question of who gets the vaccine first. And the priority will go to those at high risk of severe illness and death from COVID-19. So this includes residents and staff of long-term care homes, Canadians over 80, and expanding by 5-year increments to age 70 years old as vaccine becomes available, followed by healthcare workers and personal support workers who are in direct contact with patients, and then finally by adults in Indigenous communities where infections can have disproportionate consequences. So the final call will be made by each province and territory, which is responsible for healthcare, including the delivery of vaccines.
Just backtrack a little bit right now. Is that actually? Let's go to the next slide. Let's see what we have so far with the vaccine rollout so far.
So these are how many vaccines are available. So the federal government has already secured around 20 million Pfizer doses, and that amount has now doubled to 40 million. By exercising an option in the contract that allowed Canada to access up to 76, almost 80 million additional doses. And a total of 6 million doses are currently planned to be distributed to around 3 million prioritized Canadians by the end of March. And if you look on the chart here, this is a delivery schedule for the vaccine posted by the federal government. You can see that Ontario specifically is expected to receive approximately 196,025 total vaccines. So this is Pfizer and Moderna combined. And the federal government is planning to begin vaccinating the general population in April. And between then and June, the aim is to vaccinate between 15 to 19 million Canadians. And this equates to between 40 and 50% of the population. So then between June and September, the plan is to vaccinate almost 20 million more people, and this will help Canada hit and surpass the herd immunity threshold.
If you can backtrack a little bit over here, it's kind of interesting is that how do you decide who gets the vaccine first? I noticed on the call we have two of our colleagues working in the retirement home situation, and I'm wondering if I can get, are they still in there? Yes, Joanne and Philip to say a few things about, these are senior physicians that work in the retirement home situation. What's it like working in a retirement home situation right now? What's happening there?
Can you hear me?
We can, go ahead.
Hello. Okay, yeah, so Joanne and I, as you know, we're long-term care physicians and patients of Dr. Curnew. And the last 6 weeks have been extremely stressful and devastating, at least in the nursing homes in the Niagara area. We've had severe outbreaks. One of my homes had one of the worst outbreaks in Ontario. it didn't get much in the news because of the media is more Toronto-centric and concentrated on nursing homes up there. It's an older home with, did their best, but once it got in there, it spread like fire. Oh yeah, it's an older home with 4-bed wards, sharing bathrooms, tight quarters, wandering demented patients who are very difficult to control. They're wandering, they're touching everything, and their body fluids would get on areas no matter how quickly they clean things got contaminated. So they had in the end, I think 96% of the residents were infected. They had 120 staff infected out of about 170 staff, mainly all at the same time. About 30 deaths. The storm, side effect storm, was where they lost most of the residents. And very stressful and very sad, like a living horror movie. As far as the vaccine goes,
and it's very heartbreaking for everybody. Much like the first speaker, the lady Lisa that spoke about her family, like, it's unbelievable because these patients live in these homes. Their average length of stay in long-term care is 2 years. So they're really part of the home where they are, and it's just devastating for the staff to see them succumb to this disease.
And as far as the vaccine availability, the long-term care residents and the caregivers are on the priority to get it first, and we're seeing vaccination started in the bigger cities, and it's slowly getting out into smaller cities in Ontario. A couple of my homes got vaccinated yesterday, one's tomorrow, the other one's on Tuesday, and some of the workers are being immunized. There's controversy about how the vaccines have been shared over Ontario, and I think that's being reviewed right now. And I encourage everybody, when they can get a vaccine, to get it. Joanne and I were lucky to get we got our Moderna vaccine because Moderna vaccine because Joanna is an essential care worker, and I am in Joanna's father's nursing home. He happens to be in Toronto, and we just happened to be there the day they were giving it out, and they offered it to essential caregivers. So we got it even earlier than we would have here in Niagara. And do you have anything else you want me to add, Greg?
Thank you for sharing that story. So I have a dream, and I have a dream that we all learn from this, get stronger, get better, and get healthier. Is that no one wants to end up being in a nursing home, but in many situations there is no other option for many people. And spending the last couple of years of your life in a new family, you want to be as secure as you bestly can, but there is no good solution in some of these areas, and people have done their best. And so my plea to you is that think about making other people sick. And one of the people that we make sick is our parents, our grandparents, our neighbors. Yes, you can be a young, healthy person and still die from this. There's pediatric kids that have been sick and they get a different disease. Yes, we know about the older individuals, we know about the nursing home people, but I don't know how you would feel if you made your grandpa or grandma sick and passed away. I know you're not doing it by any intentions, but the actions that you take now make a difference. And one of my dreams is that you get healthier. Okay, the one thing for this vaccine to work, you need a good immune system. You need to make your immune system work better. The two vaccines were tested predominantly in healthier people, but people at the age of 65, in one of the trials over 7,000 patients. They still had the same protective effects as well. So lots to learn, lots to share, and thank you for sharing the story. Thank you so much.
I think this is also a good time to cue in one of our volunteers. Nicholas, are you still there? He was someone who's been fortunate enough to get the Pfizer vaccine recently. So did you want to share your story?
Yeah, sure. Thank you. My name's Nicholas. For those of you that don't know me, I'm a volunteer with Dr. Curnew since the summer. I've been fortunate enough to be vaccinated. I recently received my second dose of the Pfizer vaccine last week on Friday. I do work in long-term care, which is why I was able to have the opportunity to get vaccinated. I think some things I just sort of want to clear up based on my anecdotal experiences. Some of the side effects associated with the vaccine. Of course, different people are going to react differently. But from my own perspective, it was quite a safe vaccine. There wasn't anything other than some localized arm soreness at the site of injection, which was quite relieving. So it's not too different than any other vaccines that you may have taken in the past. And I do know there's a lot of vaccine hesitancy, so hopefully that, off of my own personal experience, might help clear the air regarding that issue or any of concerns related to those type of matters. To sort of reiterate what's previously been said, in terms of the conditions regarding nursing homes, it's quite a serious situation. I'm in a really downtown nursing home in Toronto. It's located close to college in Spadina, so it's close to the University of Toronto campus. There's currently there's multiple outbreaks in different sections, and seems to be happening pretty often. It's not like it's a situation to be taken lightly. And of course, you've all heard previous multiple experiences today already regarding the severity of the situation. So I think it's something we need to all take really seriously heading forward. Hopefully, the provincial mandated stay-at-home orders will help alleviate some of the strain on our healthcare system. And other than that, I would just say if you do have the opportunity to take the vaccine and you feel like you're in a safe position to do so, I highly recommend doing it. Dr. Curnew, would you like me to add anything else?
Wonderful. I'm going to say one more thing is that one of the observations that people are being scheduled not showing up. This has to stop. This happens too much for medical appointments and cardiac testing, for whatever tests you're doing, is that if someone made a commitment to you, you make that commitment back, and if you can't make it, you cancel. This is about lives. This is about, doing things for yourself and for society, right? So we have some people that have been privileged to get the vaccine, and I understand the choice is up to yourself. Number one reason I want to get vaccinating is my hope is that this may help prevent the spread of the disease, so I can get back to a different way of life. But the number one reason that for most people to get vaccinated, especially the elderly, is to decrease the severity of the disease and to prevent people from dying. And you can see this disease is out of control at this point in time. We need to all do our better parts. We need to do our parts in being healthier too and get your immune system better. Thank you. Next slide, please.
Okay, so hi everyone, I'm Vikita and I'm going to be talking about the impacts of vaccination and the larger importance of why we should all get vaccinated. So there are a variety of impacts, first for us as individuals and then for larger society. So as individuals, vaccines protect us if administered before exposure. And I know you've heard a lot about that during this presentation, so I'll keep it brief. But essentially, there's two vaccines going around in Canada right now, the Pfizer and the Moderna vaccine, and they have very high efficacy rates, like we said, 95 and 94% efficacy. And just as a comparison, our flu vaccine, which a lot of us take every year, that has about a 40 to a 60% efficacy rate. So this is a really high efficacy rate, and you probably won't get COVID if you take the vaccine. And there are a lot of impacts also to larger society. So annually, vaccines prevent 6 million deaths worldwide.
So just pause for a second over here. You said one thing, I don't know if that's true or not. Like taking the vaccine, I don't know if you're going to get COVID or not. I do know that you're going to have less symptomatic disease and less severe disease. So that question about preventing the disease, that's a great question. We don't have a firm answer right now. Also remarkable, there's other 100 vaccines under investigation at this point in time. So we learned so much about viruses and, from simple hand washing. I was taught way back when in medical school that I didn't always do well. Man, my hands have been washed so much more right now. So yeah, keep moving forwards.
Yeah, no, thank you for that clarification. So the WHO, or the World Health Organization, has found that in the US, there's been a 99% decrease in incidence for 9 diseases for which vaccines have been recommended for decades. And one such disease is measles, and we can see on the right a graph showing how measles had a really high incidence rate until the measles vaccine was introduced, and you can see the decrease in incidence after that was introduced, and then a further decrease in incidence after the MMR, or measles, mumps, and rubella vaccine was introduced. Next slide. The other main impact of vaccination is herd immunity. So vaccines reduce disease among unimmunized individuals as well through something called herd immunity. You can see on the right a graphic of how herd immunity actually works. So when no one has immunity or no one has taken the vaccine, the contagion has many opportunities to spread quickly. And we can see if you go a bit lower, the more immunity we have in the system, the less often the contagion comes into contact with those who are susceptible or those who haven't been vaccinated. And then if you go to the next box at the bottom, the spread of the contagious disease is actually contained when enough people get vaccinated. And so the World Health Organization actually estimates this threshold to be around 65 to 70%, but as I'll explain in the next slide, this might not be the case with COVID-19. Herd immunity is also really important for those who have medical conditions and also can't be vaccinated, so you're doing them a favor also by getting vaccinated. Next slide. Thanks. The WHO also warned that herd immunity for COVID-19 is unlikely in 2021 because COVID is very, very infectious. So the percent of the population that must be vaccinated could be much higher than 70% to get herd immunity all across the world. And I just also wanted to mention the recent spikes we've seen in the UK from the new variants of COVID. Researchers have said that it might not be the new variants that are causing these spikes, but actually decreased social distancing measures. So bottom line, we really need to maintain social distancing measures for herd immunity to actually work in the long run, and for us not to have big outbreaks of COVID in the years to come. So now we'll be talking a little bit about the myths surrounding COVID and trying to debunk some of the misconceptions that we've all been hearing. So the first myth is that only the vulnerable need the vaccine. So the fact is, young people and those from a variety of occupations and socioeconomic statuses are susceptible to COVID. COVID does not discriminate. So most people need the vaccine for us to reach this herd immunity. The next myth is that new strains of the virus could mean the vaccine won't last for long. So viruses actually mutate all the time, and it's very normal for there to be new strains of a virus. But the new strains actually still have the crucial spike protein. There's just a small variation. So the vaccine will still train the body to develop immunity. Now, this isn't confirmed, but researchers have indicated that most likely you still will develop immunity with these new variants. And Moderna has also indicated a robust antibody response for 119 days, but other experts suggest immunity for around a year. So when you get the vaccine, it isn't going to leave your system in a couple months. You might need 2 doses of the vaccine, but it's going to stick around for a while. The third myth is that the vaccine isn't safe and it'll alter our DNA. So like Aisha was saying before, the mRNA of the virus never enters the nucleus of our cells, where our genetic information, our genes, and our DNA reside. And mRNA technology has been in development for decades and has shown efficacy in a variety of disease models. So it's not something that researchers just came up with in a couple months, and it has shown to be effective. And in addition, none of the vaccines actually contain a live virus, so no one will actually get COVID-19 from the vaccine. And the final myth is that the vaccine is dangerous if I have an allergy. Now, this could potentially be the case, but allergic reactions can be easily treated without lasting consequences. So as long as you bring your EpiPen with you if you have an allergy, you should be able to reduce the effects of that with your EpiPen. The same cannot be said with COVID-19. We don't know how the short-term or long-term effects of COVID will affect you specifically, so it's better to take the risk and go if you have an allergy and take the vaccine rather than not taking it. But most definitely consult with your doctor if you are planning on taking the vaccine to make sure that the vaccine will be safe for you. I don't think you're muted.
Sorry, learn from the experts. So Dr. Fauci, I think everybody knows this guy. I didn't know who he was until the COVID situation. This gentleman's been around for an awful long time. And I've enjoyed him talking on numerous occasions. What I'm trying to learn from is from a bunch of smart sources and from smart people. I love people's opinion, but I love experts' opinion, people who know a lot more about this than myself. I'm always amazed how people think they know more than the experts. I don't. Maybe you do. Good for you. And so what we learned right now is that remarkable serious events that took place in the last year or so, and I'm just totally amazed at how some people have risen to the occasion, and we all learn better. So again, when someone gives you lemon, you make lemonade. So the understanding of viruses in general. So these mRNA vaccines will have tremendous implications for cancer now. So what's going to happen is that you're going to actually target cancer cells, and there's going to be other technology in this circumstance. So what we know right now is that just 2 big randomized controlled trials of 70,000 patients over a period of 2 months shows that you decrease COVID by about 85%. Any symptomatic disease, any severe disease, whether it prevents spreading, we're hopeful for that. How long the immunity will last for, we don't know, but chances are it will be a long term. Next slide, please. Is that vaccines are much like seatbelts or airbags in cars. Maximum protection against injury or deaths occur when they're used properly in the right setting, but there are no guarantees or absolute protection and safety. So again, is that the vaccine works by getting your immune system to work better. You need to drive your car safely, and basically, and you need to get your body better. Again, the sad part is we can't stop by getting older. We've heard from the nursing home situation. We realize that for some of us, we'll spend the last 2 years in a nursing home. Basically by being healthy, by being mobile, by being active. The single best thing you can do to keep yourself out of the nursing home is to be active. Active mind, active brain, and work on the preventive strategy. So we know that vaccines work in multiple situations. Yes, you can saw in the vaccine there was a few cases of bowel palsy, so some swollen glands in the neck, but remarkably safe so far, and tremendous effects. What we don't know is that once you get COVID, are there any long-term sequelae to that? It reminds me about concussions to the head. Growing up, many of us played sports and banged our heads. We didn't think of too much of that, but we learned that banging your head younger in life may lead to more dementia later in life and things of that nature as well. So having insults to the body may lead to long-term consequence. So treating your body well and being healthy for as long as you can is important. Next slide, please. And how can we boost our immune system? So we know that people's immune system don't work well if you have diabetes, if you're overweight. Again, know your body mass index, know your weight. So I took this opportunity during the COVID situation to actually lose 15 to 20 pounds. Boy, it's bloody hard work. Boy, I miss certain foods, but I'm doing it. If you have HIV, you have cancers or immunological deficiencies, your immune system won't work as well. And but keeping yourself healthy. I know a lot of people who have HIV and other diseases who really boosted their immune system by healthy behavior. So if you have diabetes, treat your diabetes. If you have diabetes, put into remission by losing 20 pounds if you had it for 7 years or less. If you have heart disease, treat your heart disease well. If you have high blood pressure, treat these sorts of things. So don't ignore these other processes. Next slide, please. And whether or not we can prevent the next one or not. And here's another warning. So we learned in Canada that COVID has a mortality in symptomatic people or detected people less, about 2% or so. The mortality for COVID isn't all that high, but you can see the chaos and the carnage it's caused so far right now. And is this the first one? I never thought we'd face such an event in our lifetimes, and some experts feel there's a lot more to come, and this is not the big one yet. So, so let's get ready for the fight. It's sad that in Ontario that liquor stores are an essential service. That fast food usually means bad food. We have to change that. We have to change what's in ourselves. Next slide, please. So to me is that just saying just social isolation, hiding, ignoring the problem, ignoring your health doesn't make you healthier. It leads to worse outcome in all sorts of diseases, from cancer to heart disease and to infections such as COVID and influenza. Next slide, please. So to me is that we need to get ready, we need to work together, and to me, to be healthy, you need your own. You have your healthcare bubble at home. Where's your healthcare bubble to make you healthier? Please work in this area. Next slide, please. You can do it. I have a dream. Martin Luther King said this really well. These are the shit-out stairs. I hope for you to find what your way of being healthier. This is one of our dogs. And to me is that dogs are full of love and care, but they need to be walked and loved. So we need lots of loving, lots of compassion, lots of care. And we also need to take care of our bodies. So I'm still during this COVID situation where I'm walking with Adam at 6 o'clock on 6 a.m. on Monday mornings and Friday mornings at this point in time. Is there going to be too many people around? I'm not going to go. I'm going to walk away. But right now, at that hour of the day, there aren't too many people there, and my sanity depends on being physically fit, and so does yours. So find a way to do this. Next slide, please. And here's our Christmas dinner. So you can see our bubble was a lot shorter. You can see that we had lots of fruits or lots of vegetables at this point in time, and normally we have a lot more people at Christmas. I feel bad. I feel like a bad dad by not visiting my daughter and Kelowna. She's away for the first time at the age of 18 years old. Jenna, I'm sorry we couldn't see you at Big White. Excuse me. And we'll see you soon. And be safe and keep being healthy. And keep eating well. Next slide, please. This is here in clinic. You can see that my dream for you is that you take the time to learn about your health. I can make the diagnosis. I can do the testing. I can tell you what to do. You need to make the change. Now, we can make it together. When it comes to heart disease, I know quite a bit, and I wish I can share that with you. And we have over 150 videos. I thank Stuart, Paul, and everybody in our teams that put that information. Please use the information. Please learn to be healthier. Let's do it together in all disease models. Next slide, please. This is actually my dream is people using healthier. So Chad, you make a great pizza. My wife makes even a better one. So this is Friday is pizza night, and you can see that healthy pizza. Now, you can see my cooking on the right, and these are baked beans with a couple baked potatoes. Now, it's better than chocolate cheesecake. What I tend to do right now is I get I have over 35 cans of baked beans with maple syrup, but I throw in beans to that effect. I also, we live on a farm, so we put our own beans in that we grow off the farm at this stage of time. It's wonderful. We have soybeans, so I'm actually soaking and cooking soybeans. So when you want fast food, put a couple of baked potatoes in your microwave and get canned baked beans, add some other beans, make them healthier choices at this stage. Make your own pizza. Look for better choices. My dream for you is for you to think about your diet a little bit more, as well as exercise. Next slide, please. Part of my dream is that I'm learning about new types of noodles on our website, and this is what the food of what our plate should look like. Very colorful, very healthy, and not bad. Next slide, please. Again. My dream for you is that you now use this time to find out what's important to you, and health is important. And getting to your reasonable weight, to exercise for your mental health, to know your blood pressure, know your cholesterol, know if you have heart disease, and I'm hoping that when your turn gets offered for this precious vaccines that are available, you take the opportunity to get one as quickly as you possibly can. I feel jealous that I haven't had my vaccine yet. I'm looking forward to that. One of the slides is that the hospital is getting ready for this next surge. I may end up in that hospital trying to help out sooner than later. I'm not sure what the future holds about that, but I will do my part to help as many people as I possibly can in many ways possible. But I urge you to do your part, from things like social distancing, wearing a mask when appropriate, taking steps to be healthier and getting better information on your health. We all have many dreams, and my dream is for a healthier you. And I want to thank you all for listening to the team tonight. Next slide, please. This is Devanshi's weight loss Zoom group on Tuesday nights. Devanshi and others have really put this together. This is a fun night. This takes place on Tuesdays at 7 o'clock. We meet on Zoom at this point in time. The last little while I've been walking up the Shadok steps during these things were happening. I love this group. I love the dynamic. I love the amount of patients weights are losing. We're going to start the exercise hour on Wednesday night soon, and so you can actually exercise together. I encourage you to have a 6-minute walk test. We're going to have the sugar hour, and both Bo and Junie and others and Dragana are going to be involved. And so please take the time. I have a great community that wants to be part of your community to be healthier as well and to do it safely. Next slide, please. So I have a great deal of thanks that I'm still healthy, that I'm still able to function, and I will serve in any possible way I can to help you in any meaningful way. So I thank the presenters today, and I thank the big pharma companies for in warp speed for getting these vaccines available. They're safe, they're effective, durability we have to learn. And are there side effects? Well, you saw the clinical trials. There are some side effects. Are there unknown side effects? Don't know, but we know that most of the people who get a side effect from the vaccine takes place in the first for the first couple weeks to 8 weeks or so. So if you haven't had a major side effect early on, chances are you will not. What to do about the vaccines and people that are previously had COVID? We're still learning. What about people in special categories? We're still learning. But truly remarkable. But please take the time to be healthier. Stuart, are there any questions or comments out there from people? And anybody have any comments? Please join in. We'd love to hear what you have to say. And special thanks to the families of and to the people that have gone through this disease and are not afraid to speak out and share their stories. Truly heartwarming, and for the staff working in hospitals and nursing homes, I thank you so much, and I thank you for when you come around our clinic for wearing a mask and for protecting our clinic and others as well, and just a great deal of gratitude to everybody for being healthier, and that's my dream, that we all get healthier. Questions or comments? Stuart, what do you think?
Yeah, we have a few questions, which I think were answered for the most part, but one question just came in on the concept of herd immunity. In order to achieve herd immunity through vaccination for COVID-19, would youth under 18 also have to be vaccinated?
So my thinking is that everybody should be vaccinated. And sure, if you're 16 years of age, number one reason you want to get vaccinated is to prevent spreading to other people. We also know that young people get this strange reaction, a strange rash, vasculitis, and so there may be long-term sequelae we don't know about yet right now. And we know that a lot of healthy people get this chronic fogginess of the brain and the mind, this chronic syndrome. That tends to occur often in younger, healthier individuals as well. And we don't know, by getting COVID right now at the age, let's say, of 6 years of age, does that have any impact for you 20, 30, or 50 years later? We don't know that yet. So best not to get it, and best not to give it to anybody else. So, but the priorities have been set, and that makes sense. The most vulnerable people should get it. The people that are protecting others should get it. We'll all eventually get it, I hope so. And obviously the choice is up to yourself to get it or not to get it. I can't wait to get my vaccine, or a series of vaccines, whatever is required over time. So I vote for, we do this in a organized fashion, and we do it in a way that there's surveillance to watch out and learn about the unknowns. Could there be side effects we don't know about? Absolutely. Will we learn more? Absolutely. But to me, I'm just totally amazed what we do know so far, and how good the vaccines, how safe they are so far. And I thank Andreas and his sister and the whole family for sharing their stories. Truly remarkable. Questions there, Stuart?
We just had a question come in. How do we know when it's our turn to get vaccinated, and where would this be?
That still needs to be sorted out. I think, vaccinating, the vast majority of Canadians is a huge undertaking. We've never done this right now. We're off to a slow start, but I think we learned from our mistakes. When I tried riding my bike for the first time, I fell off a bunch of times, lots of scrapes. We have a few scrapes. Now we get to ride the bike. So a lot of people involved in organizational will do it. My plea to you is that when it's your turn, you take that opportunity, and if you don't want to have your turn, you let people know, and so you don't prevent somebody else from getting vaccinated. I also plea, if you have any appointments with any doctors, anything else, if you don't want it, cancel it. Let people know. Let people know why as well. There'll be lots of questions. about how to do this. If I had the opportunity to vaccinate everybody or anybody, I would be glad to. So I look for opportunity to make people healthier, and the vaccine is one way of doing that. How that will translate, we'll learn. So the answer, we don't know yet.
This was a point of conversation that came up early in the webinar. One person asked, is COVID tests at pharmacies covered by OHIP, which Remy responded, yes, it is covered. But one question that another patient was just curious about, Dr. Curnew, your team, we're all considered essential workers. Do you have any idea of when you or your staff might be able to get the vaccine?
Because I work also at the hospital, physician at the hospital has 4 levels. I'm considered a level 2 physician. It means I'm around older, vulnerable patients on a regular basis. So I'm hopeful soon, in the next couple weeks. But I really don't know for a fact. How to get my staff vaccinated is something I'm trying to do. I wish I knew. I knew when we first started this would be a challenge, and I still have the dilemma of how best to work in the hospital and in the clinic, protecting everybody I serve, and I'm putting a lot of thought how best to do that. I don't have all the answers, and I'm going to learn from the experts right now. So I hope for everybody that we get vaccinated sooner than later. And how that's going to translate right now, I don't know yet. There's a lot of essential workers out there who are just cashiers in supermarkets. People who provide deliveries and things of that nature. Maybe Amazon should take over how we vaccinate the world. I don't know, but that's going to be sorted out. And the people out there on the front lines, from teachers to people exposed to others, are so important. So and I think we all want to be mindful that we can be asymptomatic, and getting tested now. Now the government allows us to go to, for instance, the Shoppers Drug Mart in our building. You can get tested if need be. That's relatively new, so the answer is that we're just moving forward, and we're going to have some bumps along the way. I think we have to balance what's good for the individual versus society, and I think in North America, to be honest with you, even in Canada, we lost that balance. I think we need to think of others more than just ourselves, and so that mixture of both, but certainly being attentive to what others need is very important to me, and I'm sure to you as well.
Great. That brings a wrap to the questions, so we can probably conclude the presentation. Dr. Curnew, do you have any final words or messages before we say goodnight?
I'm just grateful for the opportunity to try to serve as best I can, to learn and to share. And that's all I have to say is that keep getting better, keep getting stronger. We're going to make some mistakes, but we're going to keep getting better and stronger. I have so many people to be grateful for, and I thank everybody for listening, and for the team for putting this on. And be interesting too. We'll have phase 2 about the vaccines when the other vaccines become available, because the AstraZeneca vaccine is a different platform coming out real soon as well. So we have a lot more to learn. And again, 100 vaccines in development, and I've learned so much about infectious disease in the last year and how infectious disease affects the heart. I learned that you can make your immune system stronger by being healthier, by exercising, by eating well, by controlling your risk factors, and do it. That's my dream for you. You have the final words, Stuart.
Great. Well, I just wanted to thank everyone for working so hard to put this great package of information together. I just wanted to remind everyone that for those of you who found this information helpful or think it might be helpful to someone you know, care, or love for, all of this information will stay on our YouTube page, so you can always check back on it tomorrow if you forget information and want to review some of the information, or if you want to show a friend or a family member. I just wanted to thank everyone. We had a lot of participation and a lot of viewers tonight. Certainly a topic that's on everyone's mind these days, so we hope that we are able to share information that is important for you and help you make an informed choice when it comes to staying safe with social distancing, masks, and the COVID-19 vaccine. with that, I guess we'll wish everybody a good night, and we look forward to seeing you soon.